And unless somebody else shows up, the last questioner today will be the gentlelady from American Samoa, Amata, who is the chairman of the Subcommittee on Health and Technology. You recognize 5 minutes.
Thank you, Mr. Chairman. And I want to thank the panel for appearing today. In my home district of American Samoa, almost 100% of our businesses are small businesses. Here's my question for each of you. Considering that the United States territories were left out of the Affordable Care Act altogether, what sort of challenges do you see for these small businesses in the territories when Congress addresses reform of the small business health care marketplace? Mr. Secor?
I'm not sure what you have in terms of a system there now, so I guess it would depend on what you have today versus what you're going to get, so to speak. My guess is if they include you in this, you'll be in the same boat all the rest of us are, and some may think that's good, some may think that's bad. But I think no matter where you are, if you're a small business, our people are telling us it's cost and availability, affordable product and care. But like I said, I really don't understand what your system is today.
I think pre-ACA, during the debate for ACA and after, it has always been about quality, access, and affordability. So I think if this discussion were expanded to include the territories, which I think could expand the pools, which I think overall actuarially is a positive thing, but my best guess is same thing. At the end of the day, there would be an improvement in access for sure. I think particularly those with pre-existing conditions and those with particularly low income would have access that perhaps they would not otherwise have, but then the issue would continue to remain cost.
Agree on cost and flexibility, and it's not for a lack of desire by the business owner. You just allow the business owner to help their employees because that's what they want to do. It's not when you pile mandates or new requirements on top of them, that interferes with that relationship. So I think just sometimes the tendency to throw a heavy hand on top of it interferes with that relationship.
If we can expand the pieces that aim to make coverage for people more affordable to the territories, which doesn't exist right now, then coverage would be more affordable for individuals in the territories, so that if things were not improved for small businesses, but individuals could get premium tax credits, cost sharing reductions, and also if there were consumer protections on the insurance benefits themselves. And the other piece is investing in the healthcare system is something that is very important, I know, for a number of the U.S. territories, and making sure that, we're making sure that our citizens have access to healthcare services and good healthcare services.
Thank you, Mr. Chairman. I yield back.